Hi, I'm Kim KLeinman, and I'm interviewing David Pollens on behalf of the International Psychoanalytical Association, the IPA, as a member of the website editorial board. I'm a member of the Contemporary Freudian Society in New York City, and I'm going to have Dr. Pollens introduce himself, and then we're going to talk about an article that came out recently in The Guardian that Dr. Pollens was quoted in. So, will you introduce yourself?
I'm David Pollens, and I'm a member of the New York Psychoanalytic Institute and the Contemporary Freudian Society. I'm a trained adult and child analyst.
Okay, so there was a recent article in The Guardian. Do you want to tell us about it and, the name of the article and who wrote it? And
I think it was called The Therapy Wars.
Okay.
I was contacted out of the blue by Mr. Berkman. I think from my perspective it was totally serendipitous. He told me that he had seen my name on the New York Psychoanalytic website and thought I'd be a good person to interview about the topic. So we arranged an interview and met for about 45 minutes.
Okay. So in the article, one of the quotes was about resistance, about patients coming in and they ask for help and then don't want your help.
Right.
And I thought that was a great quote. So maybe you can tell me a little bit about that process of, how that was what wound up being a theme in the article about resistance.
Well, Mr. Berkman and I had a very wide-ranging conversation about psychoanalysis, and he was just quite interested in my experience of it and my explaining various aspects. So one of the topics, of course, was resistance. I introduced, and I probably tried to explain that aspect of treatment for 5 or more minutes. And he ended up excerpting that soundbite,
right.
Which, when I first saw the article, I thought maybe it was too blunt. But the reaction to it has been largely very, very positive, and it's been interesting because I've heard from people of diverse psychoanalytic theoretical backgrounds, all of them liking it. So from a Winnicottian who felt it was about how the patient has difficulty using the object of the therapist to other people who recognize the the unconscious role in resisting treatment and change. So apparently the comment hit home.
Great. One of the thoughts that I frequently have about cognitive behavioral therapy is that one of the differences between cognitive behavioral approaches and psychoanalytic approaches is the idea of resistance. And an example would be in cognitive behavioral therapy, they will give homework. And then if the patient doesn't do the homework in the next session, they'll reiterate why the patient should do that homework, rather than asking about why the patient might have not wanted to do the homework.
I can't really speak to that because I haven't had any direct contact with cognitive behavioral treatment since I was a graduate student, and maybe a handful of colleagues who worked that way when I worked in a hospital setting many years ago. So I would need to take a course or, see in fact what people do, what the technical instruction is, in that regard. But I certainly have a good number of patients who've been in cognitive behavioral treatment who've been frustrated by the lack of efficacy. But that's a group of people that self-select in a way come for analytically oriented treatment.
Sure. Yeah. So I was going to ask you in what way your life has been impacted by cognitive behavioral therapy's presence on the psychotherapeutic scene.
Well, I'm not sure. I mean, from the practical point of view, there are a lot of clinicians working in the city with different theoretical perspectives. And it's probably had a bit more of effect on, making it more difficult to get child patients in particular, because it's become such a popular modality for children. Which, again, I'm naive, with respect to what's actually transpiring in the CBT office, but it's never quite made sense to me how you can. They're not the 7 and 8-year-olds that I see, that I can come down, sit in a chair, and talk rationally about their problems and how to develop coping skills, which is sort of a euphemism for defense mechanisms, except it doesn't have the kind of depth of meaning that the psychodynamic approach has when it talks about defense mechanisms. And it's been my sense, indirectly, that what tends to happen in the cognitive behavioral treatment with children is they end up being play therapies. Because it's very, very difficult to engage a troubled school-age child in conversation reliably, right? If I remember correctly, Melanie Klein once said, being asked about, determining termination in a child treatment, and I recall her having said, written somewhere, that when the child's able to talk about his problems, he's well, right? So, in a sense, the whole analytic process is about being able to help a child be able to entertain thoughts about what's troubling them and what they're struggling with, so that they can begin to talk about it. And when they've reached that point, ostensibly, they're really well over the problems, right? So cognitive behavioral treatment seems to be starting with what would be the end point in a child analytic treatment.
Oh, that's an interesting way of thinking about that. I like that. It's great. Is there any other response that you've had about the article from colleagues or anyone else who's seen it? Anything that they've picked out that they really enjoyed reading? It certainly seemed to get quite a buzz, after it came out, and there was certainly a lot of response from people at New York Psychoanalytic, in the listserv about it, and people were very pleased to see it.